Hello, I'm Marcia McMillan. A new report from the Canadian Cancer Society out this morning has some encouraging news about cancer in this country, including the most common and deadly form, and that is lung cancer. The number of people dying of lung cancer in Canada has dropped significantly. New data shows that lung cancer death rates have fallen by nearly 4% every year since 2015. If we break it down even further, the report shows lung cancer rates decreased by 4.3% in men since 2014. And for women, the death rates fell by 4.1% since 2016. With me now to discuss is Dr. Jennifer Gillis, Senior Manager of Surveillance with the Canadian Cancer Society. Doctor, good morning, and thank you so much for taking the time to speak with us. It seems like we have some good news to discuss this morning. Tell us more about what the study found.
Yes, thank you so much for having me. It's really great to be here to talk about the Canadian Cancer Statistics 2023 because it really does highlight the tremendous impact that cancer still has on people across Canada, but also those areas of progress that you mentioned that we can really celebrate, but also some areas where continued action are needed.
So let's talk about the decline, first of all, in mortality rates in men and women. What did you find?
So the most striking finding was the one that you pulled out at the very beginning there, that lung cancer death rates have been declining faster than any other reported cancer type within the report. And it's actually the fastest decline that we've reported to date, and really does reflect the progress that's being made in both reducing lung cancer incidence, or the rate of new cases for lung cancer, but also the progress that's being made in improving outcomes for people affected by lung cancer.
So, in other words, are you telling us that it's sort of twofold? People are being treated in perhaps a quicker way, and is advertising impacting smoking rates? Are we seeing that as a reason why lung cancer could be going down as well?
Yes, so it's both of those things. So the strong advocacy for commercial tobacco control has really led to impacts for reducing lung cancer incidence rates in both males and females. And the Canadian Cancer Society has been a proud advocate for these tobacco regulations, and actually led to Canada being a world leader. In 2000, Canada was the first country to use plain packages for commercial tobacco, and over 135 countries followed suit. And actually more recently this year, again through advocacy, Canada was the first country, a world leader, to lead to having health warnings directly printed on the cigarettes as well. But as you mentioned, it really does speak to the progress and advancements that are also being made in research for people affected by lung cancer. This includes methods for earlier detection when the disease can be more treatable, as well as innovations in how we treat lung cancer so that the outcomes and quality of life for people diagnosed with lung cancer are better as well.
Let's look specifically at women now, because we saw also a decrease in a number of cancers for women: colorectal, thyroid, ovarian. Breast cancer was not mentioned, doctor.
Yeah, so breast cancer within the report has shown a slight decline, but it didn't. We consider anything that has a decline of over 2% per year to be notable. Breast cancer was declining. It was on the decline, but it was not as high as what we're seeing here for colorectal, thyroid, and ovarian. And really, I would love to touch on colorectal cancer incidence because the rate has been declining faster than any other reported cancer type. And this is really due, again, to the advancements that we've made in early detection, including access to screening programs across the country for colorectal cancer, where precancerous polyps can be detected and treated before the disease progresses to cancer.
Some cancers are on the rise: melanoma in men, cervical cancer in women. Do we know the reason?
Yeah, so melanoma has been increasing in men, but also in women as well, just not as pronounced. And this is really due to past exposure to UV radiation and really reminds us how important it is to be sun safe and practice sun safety. And if people want to learn more about how they can be sun safe, they can visit cancer.ca/prevention to learn more. And if there are any changes to the skin, we do encourage people to reach out to healthcare providers to look into that because melanoma is a preventable cancer.
And lastly, I
And
wanted
for
to, ask you this morning about the impact that the pandemic could have on numbers moving forward, because this is a snapshot in time, but we know that people weren't able to get to the doctor, perhaps get that early diagnosis during the pandemic. What are you watching for in the future?
Absolutely. So with the pandemic, the data is starting to come out, and we will have more and more. There have been studies across Canada that have explored the impact that it has had on cancer incidence rates, really focusing on some of the increases related to, as you mentioned, delays in early detection. But that data is still to come to give us the full picture of the impact of the pandemic, and we'll be sure to monitor that and make sure we're understanding how the pandemic has impacted early detection, treatments for individuals, and think about how we can work together as a community to make sure any crises like that in the future don't impact cancer care.
Dr. Jennifer Gillis is with the Canadian Cancer Society. Thank you so much, Doctor. Appreciate it.